There are specific methods that we have of getting patients into our offices. Yeah, there are specific methods. No, we're not waiting for the phone to ring utilizing these methods. We utilize these methods in order to get the phone to ring and to be able to do that with as little an investment as possible. So let's talk about 3 strategies that we use. One is the Care to Share card.
Now, what we had mentioned before on internal marketing, which these are our internal marketing strategies, is it's something that doesn't cost very much, like external marketing that costs big dollars to get patients in. So the internal marketing Care to Share cards doesn't cost that much to make those cards up. They're a postcard size card, a nice picture on one side that's really attractive, and on the other side, it goes over a special promotion for that person to come in. Who uses Care to Share cards? Our patients use the Care to Share cards, and our staff uses them. During the day, I give at least 3 Care to Share cards out to each one of my staff members, and their goal is to give it to a patient during the day that has made a nice comment. I'm very happy with what we've done. They love our office. Here is a Care to Share card, and we explain to them how to use this Care to Share card. So what we would like for you to do with this is we would like for you to give this card to somebody that you know of who would love their dental office as well, who would love to go to a dental practice that they are not afraid to go to, that would love to have this outcome as well, would love to improve their smile. For whatever success the patient is bragging about, we want them to offer that to a friend, a family, a neighbor, a stranger at the store to say, hey, give this to them, because on the back it shows a special they can get that normally would cost someone $425 to come in, but for this particular Care to Share card, you give it to somebody and they can come in for a discounted rate. So it's a wonderful opportunity for staff to give to patients during the day, or to have in their purse or their pocket during the weekends or after hours to share with somebody in the line at the supermarket, or their neighbor or their friend, family, to say, hey, here, this is for you. And their name is on it. So they have an incentive. We give our staff incentives for giving this out. Some sort of bonus. You can give them $25. You can give them a coffee card. You can give them a percentage of the sale, whatever the treatment plan would be. Different ways to use that, and we will we can and we will expand on those types of ideas as well. So Care to Share cards is a great way to give to patients to share, or give to staff to share.
Yeah. Now, how do we utilize the Care to Share card? Very much has to do with the next step, and that is to establish a charitable giving campaign.
Yes.
Okay, and let me just hit charitable giving campaign, because many of you know at least the term. Let's go to new patient special, and then we're going to go back a step. Okay, we want to reduce any barrier to the patient coming in to visit you. After all, the patient who comes in to visit us sees us for a 2-hour experience. They're not going to know anything about that experience if the fee to get into our office is so high that they can't experience that experience.
Right.
So, if you start saying, well, yeah, the examination is $150 and the full mouth series is $125, and by the way, most people need a CT scan, and that's $250. If you announce it up front that it's a tremendous fee, there are going to be a certain number of people who might say, hold on for a second. I'm not willing to spend $500 to find out what you're like. Although they would be willing to spend money for treatment with you once they do find out what you're like. So, yes, and then the other part of that, which Danielle had to deal with at one time, was, okay, you come in for a $150 examination, but then the CT scan is extra, but we don't tell them until the patient arrives.
Confrontation, never good for sales.
No. Okay, so you all know that we have $79. $79 includes everything. That includes the examination, it includes the full mouth series, it includes the CT scan, and frankly, the CT scan, as you know, is a great demonstration tool in order to be able to allow the patient to see exactly what's going on. And it's a big wow. It's just a big wow to be able to use the Anatomage software or similar software to that and see the bone exactly the way it looks and put the implant in. It's so good. But the only way you're going to do that is to provide some kind of not the only way, but a way in which you're going to get more patients into your office, is to make sure that, in fact, you reduce the barrier to the coming into your office to begin with. And once you've reduced the barrier and more people do make appointments with you, then you'll see that more patients will accept treatment with you, and frankly, your practice is going to go up as a result. But we talked about, what about a patient referring to you? How can we make that $79 special even more attractive? And we do that by the charitable giving campaign.
Correct. And the charitable giving campaign is very popular in so many ways. One, it's all you do is donate $50 or more to charity, and you can come in, everything's for free. So it sounds amazing to the patient. It also makes you look like a pretty good guy, because we also say we've donated more than $150,000 to charity, which is a big number. That's money out of your pocket, and they're thinking, wow, he did that. He did that. What a great guy. So it's great PR to show your patients that you donate, that you care about the community, that you do this for the community, and doing it for them as well. So it's a low investment cost for them to come in, and it goes to a great cause. So it's very popular, and we use that a lot, and I've never mentioned it to somebody and didn't get a wow reaction from that. So it's a great tool.
It is, and the charities appreciate it too.
Absolutely.
Because we're going to show you the mechanism of the charitable giving campaign in our next webinar. But the fact is that when a patient brings in a check and writes a check, let's say to the American Red Cross, and it comes to us, and then we put it in our envelope and we mail out that check to the American Red Cross, you don't think the American Red Cross doesn't know that it's coming from you and doesn't keep track of that? Do you know that Lee Sheldon became the leader, won the award for the best something leader in the medical field or something like that?
From the American Red Cross. And you've gotten awards and recognition from all of those, places that we donate to. It's like 7 different places that we donate to, and you've gotten recognition from all of them. And we've gotten lots of referrals from them. So they would say to the people that bring their animals there, or their father there, or whatever the organization is, they say, hey, if you need a good dentist, because they're complaining about something, or they're in pain, or they're desiring a better smile, you need to go see Dr. Sheldon. He donates to our facility. He has for many years. He's a great guy. We get great referrals from that.
Good. So in our next webinar, we're going to talk exactly about what the Care to Share card is and how we implement that. We're going to talk about the charitable giving campaign and how you can create your own charitable giving campaign, and what offer might be good for you in your community.
Right. And also we're going to talk a bit more about the new patient special as well, because again, remember with this, we're not talking to our members that are still 100% referral based and they think they're going to be like that forever. There's going to come a time, if not now, soon, where you're going to be wanting to get those patients directly from off the street. 1, because they're worth a whole lot more. 2, they need you a whole lot more. And 3, the referral base is diminishing. It is, whether you want to hear it or not, it's diminishing. And so to use a new patient special in that aspect is very important, because before I would have offices say to me, well, our patients don't mind paying $450. Well, because Dr. Smith is saying Dr. Rodriguez is the guy you got to go to, and they're saying, okay, well, I got to pay that money. I got to go see him. My doctor said so. Patients from off the street, they're looking for that low investment because they're scared. They don't know you. They don't trust you. They think that you're after their money. They think that you're just going to throw out some big options of dollar amount options for them. So when you have that person on the phone saying, we have a great new patient special, it's going to eliminate them from keep calling places to see who's cheaper or who's going to be less of an investment. You're going to stop the whole shopping around. They're going to say, oh, great, it's a great special. I want to go see this guy. So there's so much that you're doing with that new patient special to intrigue that patient directly from off the street, not the one that's being referred.
Good. So in our next webinar, we're going to talk about exactly how to implement those 3 strategies.
We hope you have enjoyed this video. If you have any questions in regards to it, please email us.
The American Association of Independent Periodontists is there to help every periodontal practice do better. I'm Dr. Lee Sheldon.
And I'm Danielle Joyner. We'll see you on the next video.